Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag #TheVirtualShift. My guest today is Soheil Saadat. He is the founder and CEO of GenieMD. Soheil, welcome to the program.
Thank you, Tom. It's a pleasure to be with you.
Awesome. I appreciate your time. Soheil, tell us a little bit about GenieMD.
Yeah, so we started GenieMD almost 10 years ago. We started by wanting to offer a personal health assistant on a mobile device where individuals could check their medication, be reminded to take their medication, keep track of their vitals, not only for themselves, but for their family members. And over the years, we have kind of enhanced that initial concept to today, where we have a full-blown telehealth, telemedicine, remote patient monitoring system.
Yeah, as the name of the program says, it is about the virtual shift. So COVID actually reintroduced virtual care. Virtual care was once a nice to have. COVID came along 18 months ago and unfortunately or fortunately created a new way or allowed people to rethink about how to deliver care because of lack of access to brick and mortar facilities. How do you see the market transforming because of the adoption of telehealth?
Well, obviously, COVID had a lot to do with shining the light on the value that digital health can bring. And obviously, the utilization of telehealth spiked during COVID because we couldn't go to our doctor's offices and all of the other limiting factors. And the other thing that happened is that a lot of companies saw that as an opportunity, and they introduced at times simple-minded video-only products, and they called them telemedicine. But regardless, they got some audience. So the utilization went up significantly, and now we are seeing that the utilization is dropping. But in our opinion, utilization is going to drop once the hype is over, but it is going to start going back up as companies, health systems, insurance companies, clinics, etc., are starting to develop strategies for their digital health and recognizing the value that it brought to patients and providers.
Do you think, I read that report actually earlier today in the context of utilization dropping. Do you think that the market might be looking at quote unquote telehealth in a too narrow of a view in the context of the continuum or the different modalities that support a virtual delivery system?
I think it is most of the stats that you see in terms of increased utilization has to do with the encounter-based, the episodic encounters with the patients. Whereas if you look at the broader view of digital health, you're just starting with a very low acuity encounters to a higher acuity encounters all the way to remote patient monitoring, which brings significant value to patient care. And I think if you look at all of that, you're going to see that the utilization is actually not dropping as fast as is perceived. But obviously it is dropping, but I think it's just going to go back up in a meaningful way and a sustainable way.
And that's what I like about GenieMD and what they're doing is that they really do address the full continuum of a virtual care delivery model. It's not that virtual care is the only delivery model. Integrating it into the overall delivery of care model is quite the opportunity. So with your platform, you could start someplace and ultimately, such as telehealth, and escalate into a remote patient monitoring program. Do you see your business plan moving in that trajectory? Is ultimately providing a full, robust platform that allows the client to choose where they want to start and how they want to scale?
Absolutely, and that is entire architecture of our platform is around that particular strategy. Is that we do not create silo applications that do not talk to each other, or you have to export from one system to another. A patient in one of our platforms is a patient across all of our platforms, and our platforms kind of work together harmoniously. Data generated in our telemedicine platform or a patient app is visible to the doctor, whether it's an episodic encounter, it's a high acuity encounter, or if it's a care manager monitoring a person at home. So that's the kind of a integral part of our strategy, is to provide a ubiquitous platform that just goes across all of the touch points of a person's encounter with care.
We often hear, remote patient monitoring, obviously, but we often hear about the home becoming that setting of care. We hear about the hospital home, where patients are, have medical devices in their home ultimately for many different reasons. How do you address the, one would argue, a complexity of devices in the home, but yet implementing or instilling simplicity or a frictionless approach to that consumer using that device? What are your thoughts on that?
Yeah, so digital literacy is an issue in healthcare. Even if you develop all these comprehensive products, unless patients can use them, and some of the patients are, of course, elderly and they're not very technology savvy. So our view is that utilization of these technologies has to be extremely frictionless, and to the extent possible, it has to be transparent to the patient. For example, if you ship a blood pressure device to a patient's home, if that person has to now pair this with an iPhone or do some configuration, I think you will have a significant drop of utilization, because that really is not going to happen. However, if you ship a blood pressure device that has a 4G chip in it, and it looks like your average blood pressure device that you buy from Walgreens or CVS, and all they have to do is use it, and then the number comes through the cloud to us to monitor them, then that is a frictionless experience that I think is going to improve patient engagement.
And how does the doctors themselves had argued that, hey, I can't give a patient these devices. I don't have time to treat the people that are in my waiting room today. So the monitoring of this information is just out of my hands. What's the response to those types of positions from providers?
No, absolutely right. I mean, no doctor has time to worry about individual patients' blood pressure fluctuation and so forth. So often you offer these platforms, it's a technology plus a high touch kind of behind the scenes caregivers or care managers that are not necessarily MDs, but they can be MAs, or they can be nurse practitioners or PAs that are monitoring basically these patients' vitals. And only in certain cases where it needs to be escalated to the doctor is when they can do that. Otherwise, the monitoring is really not done by the doctors. They're just way too busy doing other things.
And you did highlight who else could be doing the monitoring, but for greater clarity, is it the provider that has to hire these extra resources to do this, or do you GenieMD or others doing remote patient monitoring actually do it on their behalf?
Well, it can be both, right? So we could offer our platform to to a health system and they say we do have the personnel to monitor our patients, and that is their preference. In that case, we are only a technology provider. However, ourselves and through our partners, we can also offer the care managers and that will basically do the monitoring. So basically, we go to a practice, and we get the list of their chronically ill patients. We onboard them. We ship them all the devices based on their morbidity, and then we monitor them. And we do the billing. Of course, the money will then go to the practice, and they will pay us for the services that we provide.
Very interesting. Very compelling platform. And again, it goes across the full continuum. So what is missing in the market? Obviously, again, we're operating under a scenario of a pandemic, but and obviously there's been some emergency relief on a regulatory front. What do you see as being needed in the market to sustain the growth of a virtual care delivery model?
Well, from our side and basically providers of these digital technologies, I think we need to be providing technologies that are easy to use for patients and, for that matter, for providers. It is comprehensive. It goes across all of the different touch points of a patient and care, whether the patient is at home, whether they're traveling, whether they're at office and they're not feeling well. So providing a platform that addresses all these touch points is one area. The other is patient literacy. As I said, the ability for patients to be able to use these smart devices if they're at home. There are opportunities that we have been engaged where patients, for example, don't even have the ability to download the app. So we need to provide a platform or a solution that works with very simple-minded phones. They get a ping on their phone, they click on the link, and they join the call, all the way to kind of more complex interactions. So that's basically our view, that it has to be worked from both sides of this equation.
Interesting. So, often we hear about some of the challenges of adoption of technology into healthcare. And to your point, those consumers are challenged in its use because it's too complex. My 82-year-old mother, 83-year-old mother, handling the Bluetooth interoperability and things of that nature is just not something that she can do. And quite frankly, sometimes even doing the blood pressure cuff is always needing assistance. So talk to us a little bit about taking the sting out of technology and having the solution be focused more on the delivery of care model, as opposed to, this is technology. And because the word technology often is a deterrent, if you will, in the adoption, because people think, hey, I don't know how to do that.
Yeah, I kind of circle back to this kind of zero friction view of, way of dealing with technology. I have elderly parents, and I can tell you that although they might have an iPhone for kind of cruising through Facebook, dealing with pairing a blood pressure device with an iPhone, etc., is basically a complete showstopper. That's not going to happen. So providing a solution to the patient themselves that is frictionless, or providing ways for a family caregiver or a caregiver to be able to submit these values or conditions and so forth on behalf of the patient, which we provide, is another way of kind of getting the data, but yet overcome the difficulty of patient engagement.
Interesting. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley, and I'm talking to Soheil Saadat, who is the founder and CEO of a virtual care delivery platform, GenieMD. Soheil, again, we're in the home, complexity is mitigated. Tell us a little bit about how you envision the delivery of care, or the quality, how this all influences the quality of care. And I'll preface it by saying, again, before, with the average Medicare patient, my audience has heard me repeat this 1,000 times, but with the average Medicare patient, 5 chronic conditions, sees 9 different doctors in a given year. I'm only in front of my doctor for 15 hours of that given year. The question is, or what happens, what influences the other 8,745 hours? Because ultimately, one would argue that's where wellness takes place. Care takes place when you're in front of the doctor. Wellness takes place when you're at home by yourself. Any thoughts on that?
I think calling this technology of calling it remote patient monitoring really does not do justice to what really needs to happen. It's just monitoring alone is we're going to look at the numbers and the blood pressure is up or blood pressures are trending up and down. I think ultimately the ultimate goal has to be to keep the patient as healthy as we can and avoid the emergency room visits or hospital visits and so forth. So to that end, the ability to coach the patient based on monitoring them is where it's going to bring the real value to the patient. So if it's a diabetic patient, well, yes, we're going to monitor their blood glucose, and every once in a while it's going to spike and it's going to cause an alert. But that by itself goes, 20, 30% of the way. And the ability to coach the patient as to why your blood pressure, your glucose level spiked, how do you prevent that from happening, diet, exercise, making sure you adhere to your medication regimen, etc. Those are the additional things that has to happen for a true 360 basically view of patient care, in my opinion.
Yeah, you're hitting on something that I'm very passionate about. As you know, my father had type 2 diabetes and had severe complications. So not having the coach, even though he went to his doctors, if you're not going to listen to your doctor, one, or if you're not going to have anybody that's going to coach you in that 8,745 hours, it doesn't lead to any place good. But the point there being is, just because I developed type 2 diabetes doesn't mean I have to die with it, if you will. I don't mean to be so dramatic, but there are ways of getting rid of that chronic condition. Would you agree?
Oh, absolutely. And I think even before the patient kind of becomes diabetic or you become a hypertensive patient, there are indicators that that is going to happen over a period of time unless you make adjustments to your lifestyle. So the ability to provide programs to basically prevent people from becoming diabetic or get to a point where the arteries are clogged up and there's really no kind of going back is where we can kind of bring significant value to healthcare. And eventually, when you look at it, reduce the cost of healthcare, because once a person is diabetic, then there's really no going back. But if you're pre-diabetic, there are all sorts of things that you can do to prevent you from falling off the cliff and becoming diabetic. So that's another area of healthcare, the prevention and predicting that this lifestyle is going to lead to this particular disease condition is where significant contribution can be made.
Do you think that the health system in and of itself, the logic behind some of what we actually pay for in the context of developing new CPT codes and things of that nature is still about managing the condition once it exists, but there's not enough taking place on what you should do to mitigate the development of a chronic condition? And again, whether it be diabetes and, knowing your weight periodically and seeing it increase and having some intervention. What are your thoughts on, what might need to change relative, or what could change relative to proactive engagement with patients, whether they've got a chronic condition or not?
Well, you can read the definition of the CPT codes and how you're reimbursed. It's basically most of the time is after the fact. Now, there are some changes that is happening in 2022 that I actually am excited about. One of those is reimbursement for medication adherence, for example. And of course, the person, for whatever reason, is taking medication, so it's post that initial thing of not taking any medication. But even once you are taking the medications, there's significant number of emergency room visits because of drug interactions, non-adherence to medication, taking the medications at the right time, right amount, etc. So there are things that are happening in that direction. And in generally, one of the other things that COVID has done is just brought so much visibility into all of the things that telehealth and digital health in general can bring to the market, can bring to this expensive $3 trillion activity a year, that we're at the very beginnings of this journey, and you're going to see more and more codes, if you will, or ways of reimbursing for incentivizing health systems, doctors' offices, etc., to monitor these patients not once a year for 20 minutes, but more of a continuous basis to prevent them from getting really sick.
So would you say that the direction that we're going relative to engaging of the patient in the home, after all, 6 out of 10 adults in the U.S. have some form of chronic condition, and so the remote patient monitoring actually applies to 60% of that population, of the overall adult population. But the point there being is, we often talk about, given the data flow, because of this monitoring and things of that nature, it can coach the patient on what they, what are those numbers, and encourage them to walk and exercise and diet and things of that nature. But do you think that the programs in and of itself, so a GenieMD could serve as a trusted advisor, a coach to the actual provider, to help guide them on where critical care is needed and where he can divert other resources to handle the lower acuity type of engagements?
Yeah, so Tom, when we started GenieMD, our concept was, why don't we just provide a lot of data and information to the patient and make recommendations to them. For example, you measure your blood pressure, and all of a sudden the numbers kind of turn red, saying that, hey, your blood pressure is elevated, because many people don't know what a good normal blood pressure level is. And what we found out over the course of years is that patient engagement is extremely low. People just do not just use technology by itself. And you've seen this, Google and Microsoft and a lot of these other companies that were focused on that aspect of technology, they just finally shut down and said this is just not working. So we always have felt that the engagement is going to have to be high touch, high tech, or high tech, high touch, depending on how you look at it. So having someone, whether it is a family member, or it's a professional caregiver, or a remote monitoring caregiver, having those high touch people involved in the care is where you're going to see the patient engagement.
Very interesting. We only have a few minutes left, so let's just talk about the general market and on the regulatory front. Where would you, this program's not about getting political, by the way. The point there being is, Regardless of who's in office, where would you like to see the regulatory front go that would further facilitate adoption and use of virtual care tools to enhance the delivery of care?
Well, how much time do we have? Basically, my initial naive ask is if we could remove these artificial barriers of the state license and provide the ability for a licensed doctor in New York to treat patients anywhere in the country. And I understand that there are regulations and concerns about malpractice, et cetera, that is a concern of the state. But in general, the ability to offer a doctor's expertise across all 50 states is going to be a significant boost to telemedicine, in my opinion. So that would be my number one ask, to allow doctors to practice across state lines.
Awesome. Well, Soheil, that is actually all the time that we have today. I do appreciate your time, and hopefully you can come join us on the program in the near future. So again, thank you for your participation, and all the best to GenieMD.
Thank you, Tom, for including me. It was fun.
I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.